Alright, my name is Kaylee. I'm going to be your nurse today. Can you tell me your first and last name?
Alex Freeman.
I'm going to be testing all of your cranial nerves. The first cranial nerve that's normally not tested, but sometimes by physicians, is the olfactory nerve. Sometimes they do this by carrying a scent of like coffee grounds or vanilla. The second cranial nerve we'll be testing today is the optic nerve. This tests for visual acuity. So normally for this, they put a Smellie chart on the wall and have the patient stand about 20 feet away. And then you have them put on their contacts or their glasses if they wear it. Sometimes they do forget it though. Can you please cover your left eye with your hand? And then you would have them read the lowest line they can on the chart. And then can you cover your other eye? And you'd have them read the lowest line on the chart. And then with both eyes open, uncovered, you have them read the lowest line they can read. If they miss more than 3, then it's considered a fail and you need to document the line above. Normal acuity is 20 out of 20. Sometimes people might be 20 out of 15. That's also normal. The next cranial nerve we'll be testing is the third cranial nerve, which is the ocular motor. So I'm just going to have you follow my finger without moving your head. Just follow with your eyes. Alright, next I'm just going to be looking at your eyes with a bright light. So this is testing for constriction to light and their pupil size. The eyes did constrict to light and the pupils were about 3 bilaterally. Next I'm just going to put my hand on your nose. This is testing for accommodation, which also tests cranial nerve 4. And now I'm just going to look at your eyes again. So the patient's eyes are equal, they are round, and they are reacting to light. I'm going to have you look at my finger. This is testing for accommodation. This is actually the one that tests for cranial nerve number 4. So cranial nerve 3 and 4 are intact. Cranial nerve number 5 would be the trigeminal nerve. So go ahead, try to open your jaw against my hand. Try to move your head side to side. This is just testing to make sure they can move against resistance. Go ahead, try to close your eyes, try to open them. All right, good. And then you would usually, in a clinical center, you would use a cotton ball and have them close their eyes and put it on their face to see if they can tell where you're touching. And then you would take a cotton swab and test the cornea. But we're not going to do that today. So cranial nerve number 5 is intact. Cranial nerve number 6 we did test earlier. The next cranial nerve is cranial nerve number 7, which is the facial nerve. Can you make a chewing motion up and down? Good. So that's good. Can you say baseball?
Baseball.
And then smile and frown. Raise your eyebrows. Can you puff air into your cheeks? Great. And then cranial nerve number 7 is intact. You also normally for this you would have them taste sour, sweet, and salty. Next is cranial nerve number 8, which is auditory. I'm going to cover your ears, each one, and then just tell me what word I'm whispering.
Baseball. Baseball.
Alright, so cranial nerve number 8 is intact. Cranial nerve number 9 is the glossopharyngeal. Can you say ah?
Ah.
And then after this, you would also test usually a gag reflex with a gloved finger or a tongue depressor. I don't have those, so I will not be testing those today. But cranial nerve number 9 is intact. Cranial nerve number 10 is the vagus nerve. Can you say your name?
Alex.
And your last name?
Freeman.
And your date of birth?
10/7/01.
There's no hoarseness in the voice and the speech is clear. Can you swallow for me? Alright, so cranial nerve number 10 is intact. Cranial nerve number 11 is the spinal accessory. So I'm just going to have you try to push against my hand. Go that way. That way. Up. Down. Back. Alright. And then, shrug your shoulders. Alright, so he is able to resist, so cranial nerve number 11 is intact. Our last cranial nerve is cranial nerve number 12, which is the hypoglossal nerve. I'm going to have you stick your tongue out, move it side to side. So this is showing that all of his cranial nerves are intact and everything is normal.